I'd like to call the May 5th, 2022 Health Committee meeting to order. We have 4 members present, so we have a quorum. We have minutes to approve from our March 10th, 2022 special meeting and our April 7th, 2022 regular meeting. Is there a motion? Motion by Chung, second by Beer. Is there any additions or corrections? Hearing none. All in favor?
Aye.
I guess I'll vote too because we need a quorum to vote. So aye. Any opposed? No. Okay. Do we have any members of the public?
We do not.
Thank you. Then first up is Departmental Matters, Suzanne Scott, Adult Detention Medical. Hey there. You have one item for action, an agreement for provision of health care to incarcerated patients, McLean County Advanced Correctional Healthcare Incorporated. Can I have a motion? Motion by Chung, second by Beer. Want to talk about this, or this is just a renewal, isn't it?
It's just a renewal, yes.
Is there any questions? No. Okay. All in favor, and the chair will vote. Aye. Any opposed? Okay. You have your monthly report on pages 14 through 17. Is there anything that you'd like to say about that?
No, not particularly. It's pretty status quo.
Okay. And then this is an item for information on the LPN increase in the starting wage. Was this also something that went to finance?
Yes, so I have included this as part of Adult Detention Medical's information items because it went to finance last night and passed, but this would raise the LPN starting wage to be congruent with the recent increases at the nursing home.
Okay. So that's just an item for information. Thank you. Member Chung.
Yes, thank you. I was just wondering, because I know that COVID cases, what is the status of, I guess, of COVID right now at the jail? And I know that we were doing the testing thing, like what was it happening, every week? Anyway, if you could just give us a rundown of what's happening there, please. Thank you.
We have no active COVID cases in the jail at this time. And we're doing random checks and checks for DOC transports. But other than that, we're all clear.
Thank you. I have another question, if that's okay. And I guess this is about the raise and the LPN. So I know that you've had problems sort of because there's been a staffing shortage. I guess I'm just wondering, like, how many nurses you have, and then how many you feel like you should have, I guess.
Right now, we have 1 full-time LPN. We have 2 full-time RNs, including myself. We have 1 full-time secretary. We have 1 LPN that works 3 days a week. We have 1 RN that works 2 days a week. We could probably, to meet our allotted 9.25 FTE, have 2 more full-time positions. And it wouldn't matter to me if it was an RN or an LPN. But that's where we're at right now.
Thank you. I hope that that with this raise, that you'll be able to get some people soon. Thank you.
Welcome.
Still the same issue that every place has with recruiting nurses and skilled healthcare professionals. Yes. Anyone else? Okay. Thank you.
Thank you.
Next is Jason Tabb, Juvenile Detention.
Good evening.
Hi. You have your report. Is there anything you'd like to point out on that?
No, nothing unusual.
Okay. Anyone have any questions for Mr. Tabb? No? Thank you.
Thank you.
All right. Next is Jessica McKnight, Health Department Administrator.
Hello.
You have your monthly report. No, first, I guess, you have no items for action, but I guess the amendment for the FTE is just the informational item that probably passed finance last night, too. This is actually working out a lot better, I think, now with some of these things. So is there any questions regarding that? Okay. And then you have your monthly report. Anything you want to highlight on that?
Nothing to highlight or add, but I'll be happy to answer any questions.
Anybody? Member Chung?
Thank you. I'm wearing my mask today because I had a close contact who tested positive yesterday for COVID. And so guess I'm doing what I'm supposed to be doing. I'm sleeping in the basement, wearing this thing around my house right now because I've got 2 kids and my husband. Anyway, and then I have a test scheduled for Saturday. At least, I know that transmission is going up. We've been bumped up to medium. How long has it been for the medium level?
Just since last Thursday.
Okay, so it hasn't been, I lose track of time. So it hasn't been really that long. And have you seen trends in hospitalizations? I haven't really followed that.
Yeah, starting to see hospitalizations go up here locally just a little bit, but also across the state and the Northeast United States. They've seen the higher case numbers earlier, so they've been dealing with the spike, and they are seeing higher hospitalizations now. So it's something that we anticipate as the lagging indicator.
I guess, do you foresee doing anything more in terms of test? Because I noticed, because I was looking today at the website, the arena site is 3 days a week right now. And do you foresee having to sort of change anything right now in terms of that?
Don't foresee any additional days. We're still averaging about 15 to 20 a day, which is pretty relatively low. But testing numbers are staying steady of what's done throughout the county. It's lower than it was a couple months ago, but don't foresee adding any additional days. We're looking at least going through May at the current schedule that we're at.
Good, thank you. And then I guess, I'm wondering if you could give any sort of advice. I've been talking about this with friends and colleagues and constituents a bit. The fact that, I think from the beginning of the pandemic, a lot of the message was we want to keep hospitalizations down. And, we've kind of done that for the most part. You're seeing an uptick, but it's nothing to be super concerned about. I guess it's, so the friends I'm sort of talking to, they're sort of like trying to feel like, how can they help themselves feel more comfortable with this? I guess, it's sort of like, because that has been the message since the beginning. And, sort of feeling is that this isn't really going to go away. We might have these like spikes like this here and there as things mutate. But sort of, if you have any advice with sort of what to tell people who say like, well, what are we going to do? We have to lock things down again. These tests, the positivity rates were worse and we were, or not even as bad, and we were really locking things down. Like, what do you say to people, at least, I don't know, to sort of help people sort of come to terms with this?
The picture's a little bit different now than it was early in the pandemic. Now we have, vaccines available, treatments, so antiviral, monoclonal antibodies. So we have those tools that are available to us. And so it's not that it's less scary, but we have ways to reduce the severity, reduce the risk of someone ending up in the hospital. So I think that's what I tell people is still assess your personal risk of underlying health conditions, or if you have people in your household that have underlying health conditions that you may, like right now, if we're in medium level, community level, you may think about wearing your mask in certain circumstances, or if you're higher risk, maybe avoiding certain activities that would place you at increased risk. So it's, we don't want to panic because we do have tools that are available to us now that we didn't at the beginning. We also know more. We're 2 years in, so we know more about the virus, how it, how it transmits. So we're not wiping down groceries anymore. We know a lot more than we did at the beginning. So I think that's, we're not going to get rid of the virus. It's going to be here to stay, but we have a brighter outlook because we do know more. We have tools available.
Thank you so much for that. It's really appreciated.
Any other questions?
Thank you.
Okay, thank you. Next up is Tim Wiley from Nursing Home. And you have 2 items for action today. The first item is request approval of an engagement letter with OSF St. Joseph Medical Center of Family Medicine. Can I have a motion, please? Motion by Beer, second by Chung. Then do we have to, then how does that work?
I just can't vote.
Mr. Martin has to abstain from this vote.
And that's the quorum.
Sorry.
So we have Mr. McIntyre have to join the meeting. Okay. Okay, thank you. So if you want to talk about that.
I'm actually very excited about this opportunity to partner with OSF St. Joseph Medical Center. We were approached by the Department of Family Medicine, and we were approached exclusively. They would like to include us on the list of locations for their residents to round. And this is exciting to me for a couple of reasons. Number one, it gives us an opportunity to network with one of our local hospitals. But secondly, in my career, I've watched declining numbers of physicians who are willing to round at senior living facilities, and the fact that they're looking to introduce more young doctors to aging services is a significant need that they're addressing.
That sounds good. Anybody have any questions? So are you going to give us like updates as to how that's working then throughout the process?
Yes, this is very preliminary. They're looking at 2023 before they're even discussing a go live time. But that's the other thing I appreciated too. They're putting a lot of infrastructure into this plan, and it sounds like it's going to be a solid plan and ultimately beneficial, not just to McLean County Home, but also to the industry as a whole.
Okay. All in favor? Aye. All right. Any opposed? None? Okay, that is passes. And then the second item is request under section 108-43F2B3 of the McLean County Code to authorize nursing home administrator to offer salary above that identified in section 108-43F2B2. And I guess I need a motion by Chung, second by Beer. We received a memo regarding this, and if we need to go in closed session, let me know. If we don't think so, then I guess we can, if there's any questions that we can maybe answer, but hearing none, all in favor?
Aye.
Aye. Any opposed? Okay, thank you. You have your monthly report.
I'm very excited to present this report to you to show where the numbers are trending. We will continue to work very hard to see to it that the remaining 3 quarters of the year maintain this momentum. I'm very proud of the team, and I think I don't have nursing metrics in here, and I know we discuss a lot of the business side of it, but I want to tell you that we're seeing our clinical metrics going in the right direction too, and that's very exciting. I would draw attention just briefly to the budget management section to see the momentum that and the trajectory that we're hoping to maintain is to stay ahead of the budget. And what I mean by above budget, we should be at 25% of our budget, and for Medicare revenue, we're at 40% at the end of the first quarter, and then 37% in private pay. Medicaid revenue is 6% below budget, but that's intentional as we try to level out our payers. So we're pleased with that. And then the department managers are doing a great job at avoiding waste, and we see that in our expenses. And then to nursing's credit and to HR's credit for onboarding new employees well, we saw a 7% decrease in the utilization of agency, which translated to a savings from the prior month of $85,000 spent on temporary agency staffing. And actually, I'll go ahead and give you a preview that for the month of April, I've already run the numbers, and only 39% of our nursing shifts were filled by agency as opposed to as high as 48% in the past. So we're seeing some good things.
That sounds great. I have a question. Do you see some of these, especially the Medicare and the private pay, but mostly the private pay? Is there some residual that people were not putting individuals in, their family members into a nursing home during COVID, and that this is kind of like a rebound on some of that kind of thing?
That's a great question. Actually, I had seen a decline in private pay census in the industry overall with the growth in the assisted living market, because the scope of practice of assisted living can get stretched a little bit sometimes, and there were people who were appropriate for assisted living prior to the growth in that industry who, because of no other place to go, were coming to skilled nursing facilities. So it's appropriate that they're there, but that significantly changed the market share for private pay. The fact that we are where we are is thrilling, and I've not seen that industry-wide for several years.
I think that's a testament to how well we run that nursing home. So,
We're blessed with a great team there. We really are.
anyone else have any comments? Member Chung?
Thank you. Yes, thank you, Mr. Wiley. This is really some really great numbers, and thank you so much for sort of your leadership in this all. You were mentioning about clinical metrics, and I guess to me that I don't totally understand what that is. Do you mind like expanding upon that just a little bit? Maybe not too into the weeds, but just a little bit, please. Thank you.
Sure. When it comes to clinical metrics, for me personally, there are 5 main areas that I focus on. One is wound care and wound prevention. The other is infection control and antibiotic stewardship. The third is fall prevention. The fourth is weight management, or preventing unwanted weight loss. And then the fifth is controlling antipsychotics and psychotropic use. And in some of those 5 pillars, the home already had a good baseline, but there were a couple that gave us opportunity for improvement. And for instance, in fall prevention, we have seen a reduction in falls by 50% since January 1.
Anyone else? Member McIntyre?
With your permission. It's okay? With the increase that's passed here in wages, will there be any indication or impact on any more reduction in use of agency?
If I understood you right, you were asking with the increase in wages, would there be a continued decrease in the use of agency? Yes. And yes, I expect a pace similar to this. In this day and age, agency utilization remediation is not as easy as it used to be, and it never was easy. But I anticipate this trend continuing. In fact, we're seeing steady growth in the hiring of CNAs. It's the nurse market right now that's challenging. And I would just toss this out, if any of you have any good ideas or any good places to spread this idea. And that is, I saw that downstate, a community college offered tuition-free CNA classes. And it was actually a post on Facebook that was shared by the Illinois Department of Employment Security. So you have IDES saying, we have all these people on unemployment. Here's a place that will provide free training for you to get into the medical field. if there was some way we could find a way to implement that in this area, I think it would prove beneficial.
Anyone else? Okay, thank you. Next up is Ms. Taylor, County Administrator.
Thank you, Chairman Schaefer. I have no items to present for action and nothing to report for this committee.
Thank you. And other business and communication, our next meeting is Thursday, June 2nd. Anybody have any other business or communication to come before the committee? Okay, hearing none, we have bills to pay, and the auditor has reviewed them, and they comply with all of our adopted ordinances, resolutions, and policies. And so first up, jail and JDC Medical have a prepaid total of $137,828.05. Motion by Beer, second by Chung. All in favor? Aye. Any opposed? Okay. The Developmental Disabilities Board has a prepaid total of $68,063.16. Motion by Chung, second by Beer. All in favor?
Aye.
Aye. Any opposed? I can kind of see him out of the corner of my
I
eye.
give up.
You're next. The nursing home has a prepaid total of $218,299.86. Motion by Martin, second by Chung. All in favor?
Aye.
Aye. And any opposed? And the Board of Health has a prepaid total of $293,135.15. Motion by Chung, second by Beer. Raise your hand. All in favor?
Aye.
Aye. Any opposed? And that passes, and so we are adjourned.